Management of diabetic ketoacidosis, trends, challenges, and evidence-based strategies. Presented by Abdul Babakari, Mary Puerto, Marinas Guerra, and Priscilla Madiat. Before we explore the management of diabetic ketoacidosis or DKA, let's define it first. What is diabetic ketoacidosis? It is the most frequent hyperglycemic emergency and a leading cause of diabetes-related hospitalizations. It has a rapid onset and characterized by hyperglycemia or high blood sugar levels, ketosis, and metabolic acidosis, primarily due to insulin deficiency. This occurs primarily in type 1 diabetes, and if without timely intervention, it can lead to severe complications or possibly death. Diabetic ketoacidosis is a very serious complication of type 1 diabetes, which can be life-threatening if not managed properly. Now, let's talk about the pathophysiology of this complication. How does it start? Imagine you're driving a car, but for some reason your gas tank is empty, and instead of filling it with fuel, the car starts burning its own tires for energy. In diabetic ketoacidosis itself, it starts with insulin deficiency. So when insulin is deficient, glucose cannot enter cells, causing hyperglycemia, which means your blood sugar levels are really high. The body then compensates by breaking it down into fat energy, and then this leads to excessive ketone production, which lowers blood pH, resulting to acidosis. And this cascade disrupts electrolyte imbalance, worsening the complication. Severe lack of insulin in the body can lead to diabetic ketoacidosis. Insulin plays a vital role in our metabolism and is responsible for helping our cells absorb glucose. If it is not enough, our liver compensates by using fat to produce ketones in order to replace glucose for energy. However, these ketones are very acidic and can overwhelm our body's buffering system. When that happens, it can lead to diabetic ketoacidosis. Diabetics with comorbidities, those with infection, young adults, low income, and has limited access to healthcare are just the major factors that can lead to developing this serious complication. Why is this serious? It's because the imbalance doesn't just affect bloodstream, but also other major organs in the body that works over time. Now let's talk about epidemiology, prevalence, and significance in diabetes management. DKA, or diabetic ketoacidosis, remains a significant healthcare burden and affects 460 million people around the world according to World Health Organization, especially in younger children and those from uninsured and low-income population. Roughly 1 of 5 of them are unaware of their condition, and most importantly, of those diagnosed, a significant portion is struggling with poorly controlled diabetes, which significantly puts them at risk of developing such life-threatening condition. Well, this DKA or diabetic ketoacidosis prevalence was stable at about 30% from way back 2002 to 2010. A recent study showed there is an increase from 41% to 58%. The graph above here illustrates the sharp increase in the number of cases of DKA at the diagnosis in recent years. What this means is it's highlighting the urgent need for increased awareness and access to healthcare services, especially with diabetes care services. It is evident that early detection and intervention are very essential in preventing the potentially life-threatening complication of type 1 diabetes. To further this, there was another study that was done at 2 tertiary hospitals in Edmonton, Alberta. From 2002 to 2009, the incidence of diabetic ketoacidosis was 4.59 per 1,000 admissions, with severe cases linked to higher acute physiology, chronic health evaluation, and sequential organ failure assessment scores. Mechanical ventilation was needed in 39% of the cases, while 1-year mortality and readmission rates were 9% and 36% respectively. The 75% of the recurrent DKA hospitalizations occur following missed insulin doses. So this finding emphasizes the crucial role of consistent insulin use in preventing diabetic ketoacidosis episodes. Now let's talk about complications and detriments of poor DKA management. How would you know if it's a complication, and how would you know if it's a detriment? So if it's a complication, it's a short-term or acute effect, like for example, severe dehydration, electrolyte imbalance, and cerebral edema. If it's a detriment, it's long-term or chronic consequences. For example, acute kidney injuries, chronic kidney diseases, or neuropathies. Both can happen to a patient. For example, a patient arrives with severe dehydration and a very high blood sugar level. After several episodes of this poorly uncontrolled diabetes, this patient can experience early signs of kidney damage, which, if still unchecked, may lead to kidney failure, which is now a huge detriment, right? So it is really important to manage this, and early detection is really important as well. This is to avoid long-term detriments that can diminish the quality of life and increase healthcare burdens. So how do we manage diabetic ketoacidosis? Here is some evidence-based treatment approach that can help us prevent or manage diabetic ketoacidosis. First is diagnosis and assessment. Early detection and assessment is on top of the list as it plays a vital role in preventing attributing factors that can lead to DKA. Fluid resuscitation restores intravascular volume and helps improve renal perfusion, which facilitates ketone and glucose clearance. Next is insulin therapy or insulin adherence, which helps lower blood glucose and suppresses ketogenesis. Lastly is electrolyte management. We need to monitor potassium to prevent hyperkalemia, which is common, initially due to acidosis. We also need to monitor sodium and bicarb in order to assess severity of the acidosis. Here are some challenges and issues in diabetic ketoacidosis management. First is delayed diagnosis. Delayed diagnosis leads to severe metabolic imbalance, and without early detection, our body continues to break down fat for energy, which means more ketones, and it will result to worsening acidosis. Another one is electrolyte mismanagement. Potassium is very essential for insulin to work properly. If not corrected, it will impact insulin therapy. Sodium and bicarb, on the other hand, they play a key role in fluid balance and acid-base balance, respectively. And lastly, healthcare access. It directly impacts the prevention, early detection, and treatment of diabetic ketoacidosis if the population has limited access to insulin, limited access to clinics, or if they're in a remote area where services are not available. Poor management of diabetes can also lead to worsening of the diabetic ketoacidosis. Prevention strategies and best practices. Discharge planning includes diabetes education. It selects an appropriate and affordable insulin regimen and prepares necessary supplies for insulin administration at home. Prevention of DKA. It also includes better access to medical care and effective communication with healthcare providers. Another best practice is sick day management, which includes educating the population on when to contact their healthcare provider and establishing blood glucose goals. It also provides guidance on how to use insulin. Insulin guidance is also somewhat related to sick day management, but mainly educates on how to administer insulin and encourage family or caregiver to be involved in the care. And lastly, technological advances, which utilizes real-time continuous glucose monitoring for prompt intervention, which includes at-home monitoring. In conclusion, diabetic ketoacidosis is a serious metabolic emergency that has potential for adverse outcomes when not promptly recognized and treated. To reduce this prevalence, we must focus on early detection, proper management, and systemic improvements in diabetes care access. These requires a combined effort from healthcare providers and policymakers. While mortality is relatively low in developed nations like Canada, it remains a concern in resource-limited settings. Early recognition and prompt treatment saves lives.